Hi, today I thought I'd talk about an article by one of my colleagues in Arizona looking at the effect of vitamin D on spine curvature, particularly for scoliosis. And this paper is titled Maternal Diet Deficient in Vitamin D Increases the Risk of Kyphosis in Offspring, a novel kyphotic porcine model. And this was published in 2018 in the Journal of Bone and Joint Surgery, or JBJS. Vitamin D is a nutrient that we can easily get from just about 10 minutes out in the sun each day, or we can also ingest vitamin D through our diet. Things like fatty fish, like salmon, mackerel, and tuna, or even through eggs, and particularly the egg yolks. Cereals are also fortified with vitamin D, so that can be another way of getting nutrients and vitamin D. As I was familiarizing myself with my collaborators' prior work, I started to look more into vitamin D and how it impacts people differently in the population. The National Academy of Medicine actually puts out recommendations for the amount of vitamin D that you should get per day in terms of international units. So for people under the age of 70 years old, they recommend 600 international units per day, which is also equivalent to 15 milligrams per day. And over the age of 70, the recommendation then increases to 800 international units or 20 milligrams per day. And if you're taking supplements to get your vitamin D, they recommend not taking more than 4,000 international units per day because that can cause some other issues. So whether we get vitamin D through sunlight, through supplements, or through our diet, that is eventually converted by the liver and our kidneys into 25-hydroxyvitamin D, which can then be registered and read through blood work. And that readout is usually reported in nanograms per ml, where less than 20 nanograms per ml of vitamin D in the blood is considered deficient. Between 20 and 30 nanograms per ml is insufficient, and anything above 30 is normal or under healthy levels. Of course, looking at the literature, these cutoffs differ by studies, as well as what you might see if you get your own blood work. For example, Kaiser Permanente shows inefficiency as being less than 20 nanograms per ml rather than 30 nanograms per ml. So there's a lot of literature looking at vitamin D deficiency and how it's associated with different diseases and how it changes with age and with different segments of the population. Being able to absorb enough vitamin D either through our skin or through our diet can change drastically with age and can also be affected by skin pigmentation, where it's more difficult with darker skin tones to absorb vitamin D from natural sunlight. Approximately 40% or more than 40% of the elderly population is actually vitamin D deficient. We see that African Americans and Hispanics actually have greater rates of vitamin D deficiency, where more than 80% of African Americans have vitamin D deficiency, and 70% of Hispanics have vitamin D deficiency, according to a paper by Forrest and Studholder. So vitamin D deficiency has been associated with many different things, including cancer, cardiovascular disease, osteoarthritis, increased risk of bone fracture, as well as scoliosis and diabetes. However, all these studies that look at associations with diseases doesn't really tell us if vitamin D is contributing to those diseases or if it's just a correlation, not a causation. There was a study that looked at using vitamin D supplementation to reduce the risk of bone fracture, and they saw that with supplementation of 800 to 1,000 international units of vitamin D, the risk of bone fracture decreased in the population that they were looking at. Researchers are also starting to think about how vitamin D deficiency will impact patients' rehabilitation and recovery following surgery, like total knee replacement or total hip replacement, where a deficiency in vitamin D has been shown to have adverse effects in the rehabilitation process and the ability to recover in a timely fashion. Now, why I'm particularly interested in this is in my work on the spine and looking at spine biomechanics, and specifically thinking about adolescent idiopathic scoliosis and looking at how does vitamin D deficiency relate to adolescent scoliosis. So there was a paper recently in 2023 out of Frontiers in Endocrinology. They looked at a meta-analysis of papers that have looked and reported the vitamin D levels of patients with idiopathic scoliosis or adolescent idiopathic scoliosis. And in this meta-analysis, they saw that 36% of adolescent idiopathic scoliosis patients had vitamin D insufficiency, meaning that their vitamin D levels were between 20 and 29 nanograms per ml. A further 41% of the patient population were vitamin D deficient, so they had even less vitamin D in their blood work, less than 20 nanograms per ml. So that's a total of 77% of the patient population were either vitamin D insufficient or vitamin D deficient. So this really makes you wonder, is there a relationship between vitamin D and the onset of scoliosis, or does it just happen to be that these patients have vitamin D, lower levels of vitamin D in their blood? So we can actually look at this in animal studies, and this is a first study of its kind to be able to do this. Is a very challenging study to do because of the size of the animals and the need to grow multiple generations. What this particular study did, led by Matthew Helinski, a clinical surgeon down at University of Arizona, but at the time in University of Wisconsin, looked at vitamin D deficient diets for sows or female pigs and how that would affect their offsprings and development of spinal curvature in the offsprings. So for this, they had 3 different sow diets that were used, and the diets for the sows ranged in the amount of vitamin D included in the diet, from 0 international units all the way up to normal of 1750 international units. These 3 diet options continued through the 3 to 4 month gestation period for pigs, and then also through lactation. Once the young pigs were nursing, they actually switched the diet for the second generation, for the next generation, where they looked at 4 different diets for the nursery diet. And with these diets, they varied one of 3 different parameters. They either varied the amount of vitamin D as 0 or 280 international units per kilogram. They varied the amount of calcium, providing lower calcium at 75% of normal or 150% of normal. And they also varied the phosphorus in the diet by under supplementing or over supplementing. From the 9 sows, they ended up having 16 pigs to look at. So to look at how the spine developed over time, they took x-rays at 9, 13, and 17 weeks. And then at the end of the study at 17 weeks, they also performed CT imaging and MRI imaging. Then they had a blinded reviewer look at this x-rays to determine which ones were kyphotic based off of the curvature of the spine and which ones were not kyphotic and considered the control group. And in those 16 animals, they saw that 9 of them had a kyphotic spinal curvature. And going back and looking at what kind of diets they had, they saw that 7 of the kyphotic pigs were the result of sow diet 1 and nursery diet 1 and 2. In other words, when the mother had 0 vitamin D in the diet, as well as the pig, the offspring having 0 vitamin D in the diet, the likelihood of a kyphotic curvature occurring was much greater. The animals that had a control curvature were either fed sow diet 2 with nursery diet 4 and 2, or sow diet 3 with nursery diet 3 and 2, and finally sow diet 3, nursery diet 4. In other words, as long as the mother had vitamin D in her diet and there's some amount of vitamin D in the pig's diet, the normal spine curvature would develop. In this study design, they looked at the animals out through 17 weeks. However, the vitamin D deficient diet stopped after about 7 weeks. So they can look at how the spine curvature continued to deform or if it started to correct itself. And with the hyperkyphotic group, they saw between weeks 9 and 13 that there was an increase in that curvature. And this started to decrease by week 17, suggesting that on the normal diet that there may be some self-correction during that time period. They then repeated this study with a much larger cohort after seeing very promising results from the first 16 pigs, where they had 22 sows and resulting in 169 pigs being born. And with that split, they had 78 females and 91 males. And they looked at, again, the effect of the maternal diet as well as the nursing diet on spine curvature at 13 weeks. In this table, they show the Cobb angle for all the different combinations of diets for the sow and for the nurse during the nursing conditions. And we can consistently see that sow diet 1 results in much greater Cobb angles, which is related to maternal diets having 0 vitamin D to it. They calculated the percent of pigs for each diet that had a hyperkyphotic curvature, where nearly 77% of the pigs that received the sow diet 1 and the nursery diet 1, so 0 vitamin D for the mother and 0 vitamin D for the offspring, about 77% of those animals had a hyperkyphotic spinal curvature, which is a pretty strong result. And on the other end of that spectrum, the diet with normal vitamin D for the mother and normal vitamin D for the offspring resulted in 0 animals having a hyperkyphotic curvature. The results from this study is exciting for multiple reasons. First, it provides a non-surgical related animal model for studying scoliosis and therefore to be able to study treatment for scoliosis. One thing that would be interesting to know in this study is if they saw any differences in development between male and female pigs in terms of the kyphotic spine curvature, because they had 78 female pigs and 91 male pigs in the second half of the study, the larger repeat study. Whereas in humans, we know that girls tend to develop scoliosis at higher rates than boys. So this would help to understand, is there an inherent sex-based difference, or maybe there are just differences in humans in terms of the amount of vitamin D that's absorbed by girls versus boys. So to summarize, the maternal diet has a significant impact in terms of these animals on the outcome of offspring spine curvature development. Well, the maternal diet as well as the early diet during nursing and the amount of vitamin D involved. And it would be really interesting to see how this model can be used to develop and evaluate correction technology or procedures for correcting the hyperkyphotic curvature that could be translated to human treatment options for adolescents adolescents with scoliosis. Because one of the biggest challenges with dealing with adolescent scoliosis is being able to predict whether the curvature will continue to progress or if it will start to correct itself and no longer be an issue. And we saw even in this study that when the animals received a normal diet, there was some natural correction occurring. And I'm particularly interested in this research to be able to apply this to the finite element modeling work that we're doing, to be able to predict how the stresses of that curvature affect how the spine curvature itself affects stresses that are placed on the disc or even on that cartilage end plate, which then can change how the rest of the spine starts to grow and develop over time. So I'm looking forward to seeing what new developments happen over time, and maybe I'll report back.